Good afternoon. It's noon at lunchtime on Tuesday the 25th. So we're going to talk about Heart Health Awareness Month and a few tips to just keep your heart as healthy as possible. I will have time for questions at the end. So if anybody has questions, I'm happy to go over those at the end. Hope everyone had a great weekend. Let's get started. So heart health, there's a lot that goes around it. A lot of people are concerned with cholesterol issues, especially as well as inflammation that can lead to things like heart attacks, heart disease, coronary artery disease, things like that. So I'm just going to go over a few tests that I think are beneficial to have done. Your lipid panel is usually like your total cholesterol, LDL, HDL, and triglycerides. The LDL are the bad cholesterol, the HDL are the good cholesterol. So you just want to make sure that the bad is not too high. A lot of times a lot of my patients will have high HDL, which will raise their total cholesterol. And that's not always a bad thing because HDL is a good cholesterol. And cholesterol is needed it's needed to help process a lot of the chemical reactions in the body to help break things down, help process hormones, things like that. So just supporting that in your body will help overall health. You can also test for high sensitivity CRP, which is an inflammation marker. This can kind of tell us if there's like buildup of plaque in the arteries that may be leading to a cardiac event in the future. So you just want to kind of get an idea, especially if you have a strong family history of those kind of heart disease. ApoA is the clear cholesterol in the artery, and ApoB, if that's increased, that means there's more inflammation and more cholesterol. So that's usually a helpful test to run. The NMR lipo profile is very detailed. It runs a lot of the tests that I've just mentioned. So that's a good one to run. There's also a gene associated with coronary artery disease, 9p21. If you eat unprocessed foods, it doesn't necessarily always have to be raw. I do have raw written on the slide here, but a lot of times if you're just eating unprocessed healthy foods that doesn't come in a box, you can reduce your risk of coronary artery disease just by diet. So based on your family history and your current situation of health, you should talk to your doctor to see which tests are best for you. And here I have like a little infographic that talks about cholesterol and what the different kinds are, and just, like what numbers you should be looking for. So less than 200 is ideal. 200, 239 is high. But like I mentioned before, it's not necessarily a bad thing if your good cholesterol is elevated. So you got to look at what kind of cholesterol is elevated, because if you've got the inflammatory cholesterol elevated, then that's more cause of concern than if the bad cholesterol, the LDL or the triglycerides being elevated is more of a cause of concern than if the HDL is elevated. So just want to take a look at those types of things, and anything above 240 is high and really needs to be looked at. Next page. So just eating heart healthy foods. Here's a list of things that are really helpful in keeping your heart healthy. Eating plant-based, whole foods, fresh fruits, veggies, healthy fats. Healthy fats include nuts and avocados, seeds, and then lean proteins. So if you want to eat those things, trying to find them organic, non-GMO. You want to minimize your exposure to chemicals. So as much as you can get natural, unprocessed, less pesticides, chemicals exposure to your food, the better it will be for you. For example, grass-fed meats, humanely raised meats are definitely helpful. So fiber can help to decrease LDL levels, so making sure that you're eating a diet high in fiber. Make sure that you take in some form of omega-3 fatty acids. So that's fish oil, or you can eat fish. making sure that the fish you eat is from a wild-caught source, Atlantic source. And then, of course, minimizing salt intake. That can definitely affect blood pressure. Natural sea salt, Celtic salt, or Himalayan salt is better in those situations. Limiting alcohol intake, and then getting plenty of water. You should be drinking half of your body weight in ounces of water. Dehydration actually causes your heart to work harder because your blood is more thick. Your heart has to pump harder to get it to move and circulate through the body. So just making sure that you're staying hydrated. Another thing to avoid for a healthy heart is sugar. Sugar is very inflammatory. It weakens your immune system. And there was a study featured on CNN from the JAMA Medical Journal a few years ago that actually labeled sugar as an independent risk factor for cardiovascular disease and other chronic diseases. So we're talking about sugars from processed foods, like sweetened beverages like Coca-Cola or Gatorade or something like that. Grain-based desserts, fruit drinks, like even naked juices. Those are all processed sugars. So you got to kind of be aware of what you're intaking as far as sugar. Of course, dairy, desserts, candy, ready-to-eat cereals, yeast breads. So your most natural form of sugar would be from fruit and natural fruit juices. Freshly squeezed fruit juices are fine. So those types of sugars are good. But the processed sugars are not. And then, of course, exercise. Exercise will help you maintain a healthy weight. It moves your blood and your lymph, provides oxygen to your cells. It also helps put you in a better mood. So we actually have a program here called Shape Reclaimed. If you wanted to lower inflammation, it's kind of like a detox for getting rid of toxic inflammation in your body, as far as especially like if you're holding on to like inflammatory weight. That's one of the things that this program can help with. So as you can see here on the infographic, inflammation leads to a lot of different types of issues. Arthritis, fibromyalgia, cancers, digestive dysfunction, allergy, heart disease, diabetes, which those are kind of intertwined, hypertension, autoimmune disorders, sleep disorders. So we can kind of see that inflammation has a lot to do with your overall health. So moving on to the next page, I can kind of jump into what Shape Reclaimed is. It's a safe and effective practitioner-guided health transformation program. So you'll get this supplement, which is a Shape nanomolecular dietary supplement. They're drops formulated with different homeopathics to help you lose that toxic weight, lose the inflammation in your body. And then you get a booklet that goes over exactly what foods you should be eating. So there's no guesswork. You get a list of the foods that are allowed. And so you can go to the grocery store and buy those. And then their website has recipes for you so you can figure out what you want to make with those foods that you've bought. So it's very, very straightforward. It's very customized in the sense that I'll get into that in just a minute. I want to go through this slide first. So benefits of Shape Reclaimed, reduce inflammation, which can lead to heart disease, improve your immune function, release toxic weight. As you're releasing that toxic weight, you're going to decrease pain in your body. You're going to improve digestion. It can potentially resolve allergies. If you're eating a lot of processed foods, that can be also a contributing factor to allergies. You can increase energy, improve sleep, can even possibly decrease or eliminate medication dependency. You will have to work with a primary care physician if you decide that you want to remove medications from your regimen. That is not something that naturopathic doctors can help with in the state of North Carolina. It can also help improve blood sugar, blood pressure, cholesterol, improve mood, clarity, balance your hormones, improve skin and hair and nail health, and helps create a healthy relationship with food. So here's like some examples of conditions that are helped by shape reclaimed, fibromyalgia, fatigue, digestive disorders, hypertension, blood sugar imbalances, cardiovascular problems, sleep problems, skin disorders, joint problems, autoimmune disease, and then of course the weight. Even with diet and exercise, if you're not able to lose weight, this really helps kind of kickstart the body to be able to do that. And then of course, if you have any kind of complicated relationship with food, this can help. Not really recommended for people who are pregnant or nursing, undergoing any kind of chemotherapy or radiation, on dialysis, schizophrenia, or if you have any disorders with eating. Diabetics can be helped by this, obesity in children, and also adults. And then patients on several prescription medications and the elderly will have to kind of require a little bit more close monitoring. So what does this mean, monitoring? We actually use a urinalysis to figure out what kinds of foods you should be sticking towards or what you need to be doing to make sure you're getting the most effect from this program. A lot of programs fail because the brain receives a message that the body is starving. Urinalysis will spot these messages. Like, for example, we can see if there's lack of protein through your urine. And if that's the case, then we can adjust your protein amount by grams per day. Same thing kind of with hydration. We can see if you're dehydrated through your urine, and so that may be affecting your ability to flush out the toxins. So we're able to kind of take a look at those types of things and adjust your program accordingly to make it more customizable to you. And then the next thing, is a lot of kids these days, a lot of young people have picked up on vaping. It's very similar to smoking. It still has nicotine, even though they're saying it's less content. It still damages lungs. So it is equivalent to smoking. So that can definitely affect your heart health and your lung health. And then another thing you have to do is relax. Maintaining a healthy blood pressure via diet, exercise, and stress management. Laughter is great for lowering the blood pressure. Getting enough sleep, recommended 7 to 8 hours per night. If you're under a high stress job, finding ways to unwind throughout the day or pause and take a breathing break for 1 to 2 minutes, maybe a couple times during your workday, can be really helpful in managing and maintaining your heart health. Just really, really, really focusing on those meditation, things like that. Breathing, yoga is very good. Meditation, there's tons of apps you can use for meditation. One of my favorites has been Insight Timer, but there's Headspace, there's Calm. So just whatever works for you would be great, just to add that into your regular routine, daily routine. Tai Chi, deep breathing exercises, and taking a walk outside is super helpful. Just taking a moment where you're quiet, you're just enjoying your surroundings, listening to the birds, looking at the colors of the leaves on the trees, taking in any of the smells, just as long as you're outdoors and being able to just breathe and be present. Those are all helpful in relaxing the mind, which is going to relax your heart. And then, of course, we do have supplements we can recommend. Magnesium can help lower blood pressure. CoQ10 is helpful in lowering blood pressure as well as reducing the risk of heart attacks. For those people who are on statins, it helps keep the heart muscle strong. Fish oil helps to lower cholesterol and triglycerides. And then vitamin D may help lower blood pressure as well. So depending on what you might have going on, I would talk to your naturopathic doctor to see if any of these supplements would be beneficial for you. Here is a case I had a few months ago. 62-year-old male presenting with high blood pressure. He doesn't want to be on multiple medication. And his blood pressure is always around 160 over 100. So he's on 2 medications. He is on amlodipine and lisinopril, 10 milligrams of amlodipine and 20 milligrams of lisinopril. So I made some dietary recommendations for him, as well as some supplements and exercise. High blood pressure diet recommendations, of course, like we mentioned earlier. Reduce sodium, alcohol, and caffeine intake, increase nutrient-rich foods in his diet. So he was eating a lot of kind of random things around the house. He has a very busy schedule, work schedule, and so he was eating kind of random things that he could find, not really eating a structured diet as far as that goes, working long 13-hour days, so just grabbing whatever as he can, and then limiting refined foods and sugars. And then increasing water intake. He definitely wasn't drinking enough water, just because of his busy schedule. He just kind of would drink it here and there, but definitely admitted to not having enough. So supplements I recommended for him, I recommended some magnesium, fish oil. Oh, and I didn't list, but I also recommended some curcumin for him. Curcumin helps to lower inflammation, especially associated with cholesterol issues. Curcumin is helpful in supporting the liver. It protects the liver, which is where your cholesterol is made. So just kind of gave him those anti-inflammatory supplements as well as magnesium to help manage the blood pressure. And then I recommended that he exercise, because that was another thing he wasn't doing, as far as keeping on track with his health. He kind of let work take over, and he had a busy, like, active lifestyle at work, because a lot of his work required him to walk around a lot, but it still was not the same type of brisk walking, minimum 30 minutes daily for 5 days a week. Did a follow-up 1 month later. He's implemented everything to a T. So he was off of all of his medications except for the amlodipine, but that was reduced to 5 milligrams. So that was the only medication he is on now. He has way more energy, and he just feels better. So these are the types of things that natural medicine can help with, in the case of high blood pressure and heart health. Any questions for me? If you have further questions, we do have our phone number here, 704-543-5540. We are also offering a free 15-minute phone consultation to the ones that are attending the webinar, as well as $50 off the new patient visit if you schedule in the next 24 hours. Any questions? No. Well, this is kind of a really short webinar, but just wanted to hop on here and just make sure that got some information out there for you all. If you do have any questions, I will be posting this on our website as soon as it's ready, and you're welcome to reach out via online. Our website is www.charlottenaturalwellness.com, or you can call the number here. Thanks so much. Have a great day, everybody.